During my lifetime, I've had the experience of my mother having cancer and my husband having cancer. And when my mother had cancer, she got excellent treatment. But there was something missing. She was a name and a number on a file. They'd tell her where to go, what to do, what treatments to take. And that was all fine. And they did a good job. But it was cold. There seemed to be some warmth missing. And I really didn't realize that until my husband got cancer. And until he became treated at Compassionate Cancer Care Medical Center. Cancer is terrifying and it's traumatizing. And when you first walk in and you don't know anybody, you're scared. Not only was he scared, but so was I. After 2 or 3 visits, there was something different. The people were responsive. They were warm. You know, we don't have our master plan. We do the best we can every day with what we can. And as my husband was going through his chemotherapy treatments, he'd get a hug and he'd get a pat on the back. And the doctors would walk by and say hello. He was a person. He wasn't a number. He wasn't just a name on a chart. It made all the difference in the world. And then I realized something more extraordinary than that. They gave me many extra years with my husband. I am so grateful. But I mattered too. Oftentimes, if it's your mother and father, sister and brother, or child that has cancer, you watch what's happening. You are frightened for them. There's only so much you can do. You can love them. You can give them words of encouragement. You can make sure they take their medication and get to appointments on time. But what about you? You get worn down. Your adrenaline is used up. Your emotions feel like they're gone, but not at Compassionate Cancer Care Medical Center. I have never forgotten it. I come back to visit often. Pete's doctor comes and visits me. I consider the staff, a lot of who are there now that were there when Pete was treated, part of my family. It is the warmth. It is the hope. There is a partnership. The doctors, the patient, the families. When you walk in and they're going to tell you what procedures might be done or what medication or what chemotherapy or what radiation, you get numb. But they give you hope. They never, ever take away your hope. There wouldn't have been a better place on this earth for my husband to go and for me to be part of the experience than Compassionate Cancer Care. And I might add that when my husband passed away, he did not die of cancer. He died of other medical conditions. So the cancer treatment that he got was tremendous, and it worked. The caregiver for a cancer patient or any other critically ill patient, you feel limited on what you can do. You can take them to the doctor. You can make sure they get the medicine. You can love them. But there's only so much you can do. And then it's in the hands of doctors and God. At Compassionate Cancer Care, I felt like I was doing something. They cared about me, which relaxed me, made me less apprehensive, treated me like I was important, and all of that translated through to my feelings of my husband. He did not feel alone. He knew he could call his doctor. He knew he could talk to someone anytime at Compassionate Cancer Care. He never felt alone. And with their actions, that I was able to be a better caretaker. It's a big responsibility. It was a privilege to take care of my husband. And I was able to do a better job because of what they offered me. And it's called hope. And if anyone is considering cancer care, there isn't a better place I could think of to recommend to you than Compassionate Cancer Care.